Hello, everyone. My name is Dr. Tina Yang, and thank you so much for joining me for my podcast today, Women's Health and Fertility Podcast. I have a special guest and dear friend with me today. Her name is Malaika Clelland, and Malaika is a clinical social worker that is certified in perinatal mental health therapy, and she is also certified in EMDR, and she's a registered play therapist. She's passionate about EMDR and how effective it is with people who have experienced perinatal trauma and challenges. And Malika also has her own history with fertility challenges and loves supporting women through their own journeys. I have had the honor of co-treating many patients with Malika over the past 5 to 6 years, and I can't say enough about Malaika's work and how she's impacted my clients along their healing journey, whether they're going through fertility treatments or pregnancies and or postpartum recovery, or all of the above, actually. So thank you so much, Malaika, for being here today and taking the time to be on my podcast. So I'd love for you to share just a little bit about your practice passion, and how you started in the area of women's health, fertility, as well as perinatal mental health.
Okay, thanks so much for having me.
You're
And
welcome.
so as you said, I'm a licensed clinical social worker. I have a practice, private practice in Mission Viejo, California, and I see both clients in person in my office, and I also can offer virtual appointments to anyone in the state of California. And I started out quite a while ago, a long time ago, as a child and family therapist and became a registered play therapist and worked with kids for many years and parents and families. But what I really always loved and did a bit of as well was working with moms of kids, and then started shifting towards working more with the moms because I realized how much they were coming up with saying, I think I might have had postpartum issues. I think, or I had fertility, or there's other things that then were coming up that they had never talked to anyone about. And so I started kind of gradually getting into this area and loving it. And then I was trained in EMDR in 2019. So I then started doing that, and then really in COVID started really focusing more in perinatal mental health and focusing more on kind of the whole um, uh, area of from fertility, pregnancy, postpartum, and then I also work with pregnancy loss, and then NICU. And I also, just to kind of add one more thing, is I was a hospital social worker in both labor
Mhm.
and delivery and in pediatrics NICU area. So I had a lot of medical experience as well. And so I really enjoy working with people who've also been going through a lot of medical issues and medical trauma.
Well, you have such an extensive background, Malika. I didn't realize you had the hospital experience too. And, I think you and I share the same passion for helping our patients. So thank you so much for the work that you do. The impact that you've made is incredible. And these women that have gone through recurrent loss, and even if it's one miscarriage or multiple miscarriages, it's still such, it's such a difficult thing to go through. And I've seen many of my patients go through this like process of heartbreak, and recovering from that can take time. And, I just think that even women that have been very successful in their life, career women, very educated, and then they just get demoralized after having fertility challenges or having loss in pregnancies. So I just can't thank you enough for your expertise and the work that you do in EMDR. I'd love to hear a little bit more about EMDR. I myself have experienced EMDR, and it was a game changer for me. I definitely had a lot of childhood traumas that I didn't even know I was still hanging on to, that I was able to resolve and release through EMDR. And it was able to help me sort of develop new patterns of
Yeah.
behavior for myself. I didn't really recognize that I was in these same patterns over and over again throughout my life, even as an adult.
Right.
So EMDR was incredible for me in my healing journey. So I always recommend it to my patients
Yeah.
for their wellness journey as well. So, but just to dive in a little bit more about EMDR, would you be able to give us a little description about EMDR and what does EMDR stand for, and how is it used in your practice?
Yeah, and I would like to thank you for just sharing that because I think it's becoming more known now. And also, just, I just really encourage people that it's not a scary thing, but it can be really, really helpful. And I've seen it change people's lives. I also want to just comment on one thing you said earlier, just because this comes up all the time with a lot of the women I work with, is, that idea of when you've been so successful in work and kind of everything you've been able to do in life you've worked hard for and
Mhm.
been able to kind of make it happen for a lot of people. And
Sure.
I talk about this a lot of how you get to this place, and for a lot of people it's like, whoa, no matter what I can do a lot of things. I don't mean that you can't do
Right.
things, but you cannot make it work,
Hmm.
the month you want it to work, a lot of times. And so in everything can be exactly in place and you've done everything right. And it kind of, that controlling piece comes out because we
Absolutely.
all want to have it be successful. Let's say if you're doing an IVF transfer or even just doing natural,
Hmm.
it still is this very difficult, like everything, like why doesn't it work when everything
Right.
seemed to
Right.
be.
I'm a A+ student. I've
Yes,
checked off all the boxes. I'm
yes,
doing all the right things,
yes.
and
And
I'm
eating
doubling
right.
over and everything.
Yeah.
Yes. Right.
And I hear that with pregnancy loss too, because so, pretty much, and this is, we'll get into the EMDR piece of we really focus on part of EMDR and is we focus on those negative beliefs that develop about ourselves.
Hmm.
And so EMDR, not to get ahead of myself, is eye movement desensitization and reprocessing. That's like the full name. We call it EMDR as kind of obviously trying to shorten it. And it really
Hmm.
is a type of therapy. And the best way to explain it is it works with your nervous system, it works in your body, and it's different than working with like cognitive behavioral, where you're just trying to change your thoughts. And there's nothing wrong with CBT. I'm not trying to say that that doesn't work because I do incorporate some of that as well.
Hmm.
However, what we know is when there's been a trauma or what I like to call kind of difficult experiences, challenging experiences, because trauma is kind of a big used word these days.
Hmm.
So sometimes people are like, "Well, I don't think I have trauma," and we also can sometimes talk about it as a little t trauma versus a big
Hmm.
T trauma, and it really depends on how each person experiences things, and it's kind of in their own life and how they view it. Um,
Right. Right.
so, but it can, definitely we know anyone who's going through fertility, through loss, that those are extremely difficult and challenging experiences. And it starts to kind of live in the body. And so if I use an example of somebody who, let's say, had a loss, um, and they were at a hospital, they went in, and found out that something was wrong, that for when a horrible thing happens and is that then it starts to live in their body. And I have people who can't drive by the hospital, they can't without getting a big like sensory reaction. So
Hmm.
when it lives in your body, it is in your smell, in your taste, in your in all the senses, and what you hear and what you see. And so for people, like let's say they feel like they've worked through something and they're doing better, and that literally they could walk into a hospital and boom, everything comes back, and they're all of a sudden having that panicky feeling. And
Hmm.
that's because the trauma lives in their body and it hasn't been reprocessed and worked through in a way that will help the body to kind of metabolize it. And then
Right.
the nervous system shifts into nope, we're in the present. Because what happens is a lot of times it's like your alarms are going off in the body, and it's like you're re-experiencing like it happened on that day. And so that's what we work with, is kind of trying to shift that in the nervous system back to kind of like you're in the moment, you're present moment, and you can work through this. with one foot here in the present, knowing that you're safe to go back and look at that memory, and then one foot back in that memory. And that's how we kind of do it's called dual attention, and being able to reprocess through bilateral stimulation. So it's kind of, we use tapping for the body, I use buzzers, or we use the following the fingers, and that's the traditional way. Which there's a lot of different therapists who use different ways, but it's all bilateral stimulation. So
Thank you for
a
that
lot.
very that descriptive explanation. When patients ask me what EMDR is, I give a little snippet of information, but that was a really helpful definition of what EMDR is. And I think that it's such a once you describe it, it's so easy to grasp. But I think when you listen to the title of EMDR, I think it can be a little bit confusing for patients, even myself,
Yeah.
before I experienced EMDR myself. So I have so many questions for you, Malika. One question that I get asked quite a bit from my patients is, so how many sessions of EMDR do you normally need to heal from a situation, or what's usually recommended?
That's
So I
always a
wanted to
hard
ask,
question,
yes.
but a good question. So what I always kind of say is it depends on a lot of different factors. But one is, if there hasn't been a lot of childhood trauma or other things that might come up or that need to be worked on, and let's say it's a current thing that just recently happened.
Hmm.
So I work with a lot of birth trauma. And so if I have somebody who's had, a really like bad, difficult birth, and has, a lot of trauma from that, like they're just re-experiencing it all the time, then sometimes that if we get into it and kind of get into it, and that's kind of all we're really working on. It's a little more complicated than that, but then sometimes I've had people do 6 sessions or so. I would say, because we still need to do a first session of, I get history. We still have to do is we have what we call 8 phases, and it's not as crazy as it sounds, of like, but we definitely need to take the time to make sure that we are working through it properly. So but however, sometimes things can be worked on very quickly, again, depending on what it is and how the person is experiencing it. And it could be just a couple of sessions. But I would say the majority are probably 3 to 6 months or less. Like I said, if it's like what we call a single trauma.
Hmm.
And but I feel like the hard part is, for a lot of people, especially with fertility, or like recurrent loss, is those things are also ongoing. And so then
Sure.
that's a difficult piece of, kind of like, you can't, it's like you might be able to resolve some of the past stuff, but when you have ongoing, that's the part that people ask me about too, because they're still in this treatment process. And
Right, right. And things come
so,
up
yes,
along that journey of treatment too.
yeah,
Yeah, whether they're trying naturally or through
right,
IVF or some kind of ART for sure.
yeah,
So that makes sense. I personally have had smaller sessions, or sometimes there'd be times when I might need more. So I do understand that I think each situation can be different for patients. So, but that's a good kind of like average number. That's
right.
that's a good gauge, and I think that it's helpful for prospective patients to know that too.
And
And I actually was really surprised my first EMDR session, coming from more of traditional therapy of background when I was younger in my 20s, and then going through EMDR, I was really surprised at how quickly it worked. And so, and I'm all about like quick results.
yes,
I'm kind of an impatient healer,
yes,
so which I think a lot of practitioners can be.
right,
So I'm glad that you mentioned that some situations or small T's can be taken care of a bit quicker
yes, yes,
versus things that maybe are, going through ongoing treatment.
right.
So
And
can I ask a question as far as the work that you do for fertility patients, and then postpartum? I'm assuming a lot of your patients stay through all those phases of. if it's IVF, for example, their fertility journey through IVF and then pregnancy support as well as the fourth trimester and postpartum. Is that pretty typical and common for patients to stay with you through all the phases?
I would say so. What I do is I'm pretty flexible, and again, being in private practice, I can do this where like I usually like to say to people, I like to start out weekly, at least for a few weeks, kind of just establish, and we can kind of decide what makes sense. I know sometimes there's, financial and time constraints and
Mhm.
those kinds of things. So I really work with people. But if we do every other week, but as people, let's say they get pregnant and then they kind of get through their first trimester and they're feeling a little better, we might go, even less, like
Mhm.
every few weeks or something. And I kind of let people decide and guide me on what their needs are too. And I might say sometimes, well, I think this would be really helpful, and if we're going to do this, it would be better to have you come in more frequently. But I do work with people that way. And I feel like in postpartum, for some people, once they have their baby, and if they're not having a lot of postpartum issues in that fourth trimester, I might see them occasionally. I also offer an in home visit
Oh,
once in
that's wonderful.
postpartum, as yeah, if people would like that, because that can be
Mm.
helpful as well.
It's tough to get out of the house
Yes,
when you have a
yes,
newborn.
right. And
And I
or we
think
can do virtual. Yeah.
yes, and I can see that that's a similar drop off for us too for acupuncture
Right.
is that after you have a baby, it's really tough to get daycare and somebody to watch your baby. And if you're nursing,
Right.
that's even more challenging to leave for a couple hours. So, but that's wonderful that you provide that
Yeah.
house call.
And
What a
people
great
can bring
option.
their babies with them as well. And
Hmm.
so if we're doing any kind of intense EMDR, I don't recommend it. But if a baby
Hmm.
is sleeping or pretty, easy, and like I said, I do EMDR with some talk therapy, so it's never like people have to come in and I'd be like, okay, nope, don't tell me about your week. We're just gonna jump in and do that.
Right, right. Well, I
Um,
love your custom approach. You know,
yeah,
everything seems like it's tailored and customized for each individual.
yes,
So
yes.
that's awesome.
Finding what
So
makes sense.
yeah, so I was thinking about something the other day and because you and I both do a lot of work in the IVF space. And so this was a question that I was thinking about, and maybe you have an answer or maybe you see a trend in this. Do you see women with more difficulties in the postpartum phase if they have gone through some type of IVF or ART treatments? Have you seen a pattern like that?
Yes, oftentimes we know that we call it PMADs, like perinatal mood and anxiety disorders. I don't like the word disorder. I don't
Hmm.
like because, so I kind of call it postpartum or perinatal, anxiety. I feel like anxiety
Hmm.
is actually a higher one, especially for people who've been through, fertility, ART, because they're already anxious about just getting pregnant, then keeping the pregnancy, and it kind of builds. And
Sure.
so then they're anxious until they have the baby,
Right.
because and it makes sense. It's like all that you've
Mhm.
gone through, and it is, so it feels like every day is like hoping, to get to the next day, if there's been a lot of if this has been a long stretch of time getting pregnant.
Sure.
So I know that a lot of times when people have been experiencing more anxiety or maybe low mood, is that they often can have a bit more, they're more uh, liable to actually have some postpartum struggles. But not everybody, but I would say that yes, and we have research on that it comes out more depending on, especially when people have been pregnant, anxious in pregnancy.
Right, right. That makes sense because I
Drop
do see
off.
that pattern too, but I was just curious in your practice what you see.
Yeah.
So walk me through, and I'm sure the listeners would be really interested to know what is a typical EMDR session like?
Okay. It depends
I
where we're
have all these hard questions for you,
I know.
Malaika.
I have to think about this. So what I do, like at the beginning, and I think this is important for people to know, is, and this is kind of what we call standard protocol. again, it's not that it's not talk therapy, because it is, but it's we're really trying to let the body do the work. But in the beginning, what we're doing is kind of like I said, getting some history, and we're really looking at negative beliefs about the self, because sometimes we don't realize that we have negative beliefs, that we've developed over time, and it doesn't take much to start, especially if you're struggling to get pregnant and it's like my body failed me or is failing me, my
Mm.
body isn't working properly,
Right.
or it can be a lot of different things. I have a whole list just specific to perinatal. So what we do is we kind of float back. Is there times that you felt this before, like earlier in your life? Does it relate to anything else? Because we want to know, are there other memories that this is associated with? But then, so we do the negative belief and we associate it with an image. So if it is a loss or something, I'm going to use a bigger thing, but let's say it's a second trimester loss. It's like that is the image that we are working on to really try and desensitize and reprocess, and we are pairing it with a negative belief about yourself. And
Hmm.
then we also look at what's a more adaptive or positive belief you would rather believe in. So we do that. Then we go to kind of what are the emotions, and then also where do you feel it in your body. And then we do what we call as a SUD scale, which is in your body on a scale of 0 to 10. When you sit here, with 1 foot back in that experience, is 10 being the most disturbing in your body, 0 being it doesn't bother me at all, where would you put it? So we start there, and then really the goal is then we get into reprocessing. In my office, because I typically use the buzzers more, is that people will hold buzzers and they go back and forth, and they're kind of fast when we're reprocessing. And so we do that to kind of help reprocess the memory, and I will ask, what did you notice? And you're kind of watching it like a train go by. If it feels so on fire and so difficult to even think about trying to go to, because I've had a lot of people who it's just too overwhelming, too much, is I'll do short little another way of doing it, with where we're just focusing on that and really trying to keep grounded and in the moment. So,
Hmm.
and I'll add on top of that, that I forgot to say that I also do before we ever start EMDR, is really doing what we call resourcing. So I teach a lot of skills that they can also use at home. So
Hmm.
it's I often will do a calm place or something, a version of that. Also, a container that can hold all the thoughts and feelings and things that you're experiencing, so that at the end of a session, we wrap it up and kind of bring the body back down. I like to talk about my office also being a container to hold
Sure.
a lot of that, and like you can walk away. There's a lot of other kind of resourcing things I'll do too, that again, what we talk about is kind of strengthening that adaptive information that will help hopefully your body to start to be like, okay, I'm safe, I'm okay, I can kind of calm
Sure.
down rather than go into that panic mode.
Right,
I
right.
have that trigger. So,
It sounds similar to visualization or guided
yes,
imagery.
yeah,
Yeah,
it's
that
very
that could be so effective.
right. And we work on kind of, pairing it with breathing,
Hmm.
and kind of those kinds of things. I try to keep it very simple, because when your body is basically like your mind is on fire, we kind of call it like a fire and we're putting a hose on it. We're trying to like get it out all the way. But when your body is like that, it's really hard to think, oh, wait, how do I do that breathing, that box breathing? Or there's a lot of different ways out there. I keep
Sure.
it really simple of teaching just a few basic body breathing, body techniques, so that it's not, you can think about it in the moment. And we pair that with tapping as well, so then people can do that at home. So
Okay.
I
I
teach
love
all,
that. I think the
yeah,
simpler the better because,
yes,
everyone's life is so busy.
uh-huh,
And if you are going through treatments, there's a
yeah,
ton of appointments. So being able to have these self-care techniques at home at your disposal or conveniently accessible for you is key
yes,
to keep patients like calm and anxiety free between sessions too.
right.
So I love
I
that.
I'll add one more thing, is I also do, especially people, let's say they're doing IVF and they're anxious about an upcoming transfer. And I know you do a lot of stuff around that. I will also do what we call a future template. I mean, these are just kind of clinical words,
Mhm.
but really kind of working on going through that in their mind. So it's almost kind of that pre-rehearsal of kind of picturing
Sure.
but also with some tapping, so it's kind of calming the body, and then give a lot of different ways of, trying to use that when they go in for a transfer or for a procedure or those kinds of things where they know they could get more activated.
Wow, that's
So,
incredible. I love that.
yeah.
I think everybody needs to see you before they go in for a retrieval and before their transfer, because I think there's so much of a buildup, and it's like a performance, almost like you said, like a pre-rehearsal. And you need that practice. And the more prepared you feel, I feel the more like settled you feel about that day as it approaches.
Right.
So that's awesome. I love that. So I have one more question about your practice. I know it's probably really hard for you to decide this, but what is your favorite thing to treat in your practice?
Yeah, that's I enjoy, I feel like I've really become kind of what I would call a perinatal trauma therapist. And
Mhm.
so I really, I mean, enjoy is probably a hard word, but like, helping
Or
people.
what's your passion, I guess
Yeah,
that's
yeah,
probably a better word. What are you
right,
most passionate about, and what are you most called
right.
to treat and support in your
I,
practice?
Yeah, no, I appreciate that. And I think, I really enjoy doing birth trauma, medical
Mhm.
stuff. I work with some moms who have more medically complex kids and have been through a lot. And so I have been NICU stays, those kinds of things, just,
Mhm.
having that medical background. But I think I'm really passionate about fertility, and that fertility journey, because it is such an up and down. It can be so long, and it,
Mhm.
feels like every month rides on certain things, and
Right.
it's not something where, people really need support. And I will say, the the thing that happens for a lot of people is cognitively it's like, okay, I can talk about the story, or I can say it and without feeling. But what happens is, a lot of people, or if, let's say, a loss too, is that they kind of try to ignore it or put it over here, like, I'm fine, I'm
Mhm.
doing
Mhm.
fine, because they get through every day and they're fine. And I'm not trying to say that people aren't fine, but I do think what happens is people keep putting it to the side, but it still lives in the body. And I think over the last couple of years, that's what I've really learned, is like, oh wow, this really can affect the body in so many different ways. And so it's important to acknowledge that and try to work through it. I'm not saying
Mhm.
that, therapy or EMDR is for everybody or needs to be. It's just that I think I know for myself, way back when, I was kind of like, okay, what's the next thing? What's the step?
Right.
Just do it.
Right.
And I work with a lot of my clients, like, who are like
Mhm.
that, and
Mhm.
doing, but they're also like, oh wow, but I am having a lot of feelings around that, feeling anxious.
Yeah, I mean, I think being in that proactive state helps patients feel like they're,
Or control.
heading in the right direction. But I think what you said is spot on about how it still lives in you, and putting it aside or suppressing those deeper feelings can come back and kind of bite you later on. So, and I'm sure, from a clinical standpoint for us in Chinese medicine, we always think about how those feelings can create stagnation or blockage in your body. And over time, those blocks can really impact your fertility or just your healing process.
Mhm.
So I think being able to release those blocks and stagnations through EMDR, through acupuncture, or whatever modality of treatment feels right for the patient is key to the process, their fertility journey, and to having a healthy, successful pregnancy and postpartum. So, yeah, I totally agree with you on that.
Yep, that's why I refer to you too, because I think
Thank
it's
you,
a
thank
whole
you.
mind body, approach, right?
Sure.
And um,
Well, and it's hard to get off the train. Like, I call it the IVF train.
yeah,
You're like on this bullet train, and you don't wanna take any stops because you just wanna get to your destination. But I always tell patients, sometimes you gotta get off for a little bit, and it's okay. Get off, walk around a little bit, take a breather, and don't feel like it's a disservice to your health to take a pause and take a break. Sometimes you need it, on a mental, physical, emotional, spiritual level, for sure.
yes.
So yes, I'm just, I really, like, I can't tell you how grateful I am to have you in my circle of healers and practitioners, and to be able to collaborate with you and co-treat with you. And, I'm just even thinking about a patient today that I just got some great news on that I know that we both see. And it just warms my heart to have these patients share their wonderful news, whether they get pregnant or, whether they had like a really successful labor and delivery process, and
Yes.
they're happy at home with their babies.
And
So
can I
so what
add?
Mhm,
Oh, I was just
sure.
going to add one more thing. When you just said that about, I think that has been one of the biggest things for me is when, like you said, when people, become pregnant and start to feel like they can manage their, just all the feelings of it a little bit better and feel a little more in control of that. But also, I've had a lot of my birth trauma clients deliver another baby and
Yes.
feel like, oh my gosh, I went through that. And the goal is
Mhm.
not necessarily saying that something can't go as we know, birth, can go all different ways. However, feeling more empowered, feeling like they have a voice, that's what I work on. And so many
Yes.
people are like,
Yes.
I had a whole different experience because
Right,
of all
right.
the things that I now know and put in place. And
Well, I think as a new mom, you have a hard time advocating for yourself, and sometimes you can be put in a very clinical situation where, a lot of things are driven by fear.
yes,
And so, being a new mom, you want to be compliant, even though it may not feel right for
right,
your body
right,
to have a certain medication or be induced or get an epidural, whatever it might be,
yeah,
but second time around to be empowered is key. I had a similar experience like that. And I am so happy that I had a kind of a do-over, and to
yes,
be able to say, like, this time I'm going to advocate for myself
mhm,
and make the choices that I want to make and trust that I know what's best for my body. So I'm so happy that you're able to work in that space with women, and a lot of patients, especially VBACs, if they're
yes,
they're
do a
they're
lot of
going through, yeah. I think that having this type of um, treatment is really important for them to be able to get through that and not have some of the old experiences creep in
yes,
and block them from having the best delivery they possibly can second time or third time around even.
right, right.
So
They're not reliving the last one because it's
yes.
been metabolized and reprocessed.
I
And
love that I love that you say metabolize, because that just makes
that's
it
an
seem
EMDR
so
word.
like, "It's over now."
Yeah,
I love that word.
yeah.
I just love how you said metabolize, because to me it seems so final in that they've digested it and now it's all processed
And I
and
will add one other thing,
Mhm.
and this could be a whole other podcast, so I'm not going to talk about it a lot. But grief is a huge one that I talk to people about of the EMDR. The goal of EMDR is not to take away grief. It doesn't get rid of grief. When you've lost a baby or
Mm,
pregnancy and you're grieving, this is to help the body not feel like it's on fire or feeling like I can't handle it in or go by certain areas or see certain things. Again, even with EMDR, going to a baby shower is not something that I recommend if people are feeling like that's just too much and
right,
those kinds of
right.
things. But it doesn't, so people get really worried like, will that mean that I don't feel sad or miss my baby anymore? I'm like, absolutely not. They're two
Mhm.
different things. And so I'm glad that you kind of just said that. That made me think of that because, and I explain that and work through that a lot with my clients that that is not what EMDR does and is not the goal because you still have that grief and we work on then how do you carry that baby with you in your heart and how do
Right.
those kinds of things of moving forward. It's not
Mhm.
letting go and saying I'm done and I don't care anymore because
Right.
of course it will never be okay. And so I'm really want to emphasize that because that's a really tough one for people.
Thank you
um,
for sharing that, Malika. And yes, I would love to talk about that on our next podcast together.
okay.
So thank you again so much for your time, Malika. I have one more question for you, that I'd like to close with, and that would be, what would you recommend for women that are either going through the fertility journey or perhaps kind of going through that pregnancy loss and pregnant, and kind of coming into a delivery and postpartum period? Any advice or words of wisdom that you would share with these women?
I think one of my biggest things that I talk about is getting sleep and figuring out who is going to be part of your postpartum support.
Mhm.
And everyone needs that. I see a lot of people where there's still what I would call trauma from COVID, where there was no one there to really to be able
Right.
to support them.
Right.
They
That was
had
a
to go
tough
through all
time.
these appointments by
Mhm.
themselves, those
Mhm.
kinds of things. And I think what we've really learned from that is that that is not how it's supposed to be. And people need support. And if you don't have, family or do you have friends? If you have the financial means, can you hire a postpartum doula to
Mm.
help or an overnight? But, really preparing for those because postpartum, no matter who you are, I think is especially difficult because of the lack of sleep that creates a lot more kind of then anxiety and mood and is my baby going to sleep and again it depends on what kind of baby you have, but I've had people say my baby's easy but I'm still struggling. and
Right.
and then
Right.
you've got the other side where very challenging babies who won't sleep at all, and so I always just say make a postpartum plan. I have a lot of different things around that, but depending
I
on.
love that because I think a lot of us just focus on my labor and delivery, and
Yes.
then there's not a
Oh,
lot of thought that's put into, okay, what am I going to do in my fourth trimester, and how am I going to support my recovery?
right.
And so there's definitely a lot more than just
Yeah.
labor and delivery and getting
Oh yeah.
through that piece of it. I actually think that the postpartum part is even harder.
Yes.
And
Yes.
but there's a lot more conversation around it now. I feel like when I was having my kids,
Hmm.
20 plus years ago, it was really different and there weren't resources out there. And now there are so many amazing people with postpartum doulas and just folks that postpartum midwives that really just kind of scoop you in and support you and nurture you. And we all need a
Great
village.
lactation people, like
Yes, exactly. Lactation folks.
lactation,
Mhm.
you know, and though, there's so many people, right?
Right, we need a village. We
Yes.
don't have to do it all by ourselves, and it doesn't make us, less of a mom if we lean on people. So,
That's so
yes.
important to say. Yes.
Yeah, yes. Thank you
You're
for
not
thank
meant
you
to be
for
able to
that
do it all.
reminder. Exactly. Please ask for help
Yeah.
because if you are a more well-adjusted mom, everyone in the family unit is gonna be happier.
Yes. Yeah.
So,
For
yeah, so
sure.
no guilt around that for sure.
No, not at all.
All right. Was there any last words that you wanted to share with us, Malika, before we end our session together?
I don't think so. Just I'm grateful to be on here and talk about all of this. And, I do want to give a disclaimer that anyone who is familiar with EMDR, this is kind of like that brief, quick overview.
Mhm.
There's a lot to it, but at the same time, I hope that that really helps people to understand a little more about how it works um, and and hopefully feel more compelled to get some help with using EMDR and getting support that way if there's been really difficult experiences. Um,
It was very helpful, Malika. I learned a lot.
Good.
Even being a patient of EMDR, I think I learned so much just from the way you've explained how your treatments go and the mechanisms of how it works too. So, how do people get in touch with you? What's the best way for them to reach you?
Yeah, I would say my website, and my website is thenestfamilytherapy.com. And so I have information about my services, about myself. I have a contact page. I would say that is the best way to kind of get to know more about me. I also have an email, but that's on the website. So I would say probably just go there.
Okay,
And
great. And I saw on your website that you also have discovery calls that you offer.
yes, yes. So I always like to do, I kind of say about a 20-minute phone call, 15
Mhm.
minutes with anyone I'm going to see so that I can get to know them. I really believe in a good fit. And so if you're going to see a therapist, I always say I don't want you to waste your money or your time if, I'm not the right fit. And I have other people that I can refer to. But I really believe in that, and I feel like I want people to tell me a little bit about what they're looking for on the phone, Any questions they might have. I kind of tell them just a little bit about my practice. And then if they're interested, we go forward and set up an appointment and kind of move forward from there. But I think that that's really important because I want to make sure that I also feel like I would be the right fit for somebody. Because
Mhm.
sometimes I've told people, you know what, I know somebody else who, this is kind of their area. And I would
Sure.
definitely, because I'm not necessarily as specialized in whatever they may be calling about. So,
Okay, that's
um,
wonderful. Great. I'm so happy that you offer that for
yeah,
patients because I do think that it's really important to have a good match when
right.
you're seeing a therapist. So,
For sure.
all right, Malika. Well, thank you again for being on my podcast. And I look forward to having you on again to talk about grief and some other things. And again, thanks again for all the amazing work that you do for our community.
Yeah. Thank you so much for having me.
You're welcome, Malika. Take care.
Thank you. You too.
Thanks.